So Greg, we've got this class, Studies in Medicine, but what should we actually include it in? Medicine's a vast field.
Well, I think one of the important things to understand is just the history of medicine. And so we should talk about the evolution of the thinking that goes along with medicine. That has been one of the greatest mysteries of mankind, the quandary of disease.
Well, then we'll include the scientific history of medicine as well, the development of the scientific method, the philosophers that played an important role in that during the Renaissance, and the development of the real science of modern medicine as well.
Right, and see, the Renaissance is going to play the major role as the advent of medicine. And we're going to describe medicine as the treatment of disease. And the idea would be that before you can understand treatment, you have to understand disease. So this is also going to be a study in disease to begin with. It's various causes, how they intermingle, the evolution of disease through time, all those aspects of disease.
And of course, medicine has a deep psychological component as well, and I imagine from your time as a practicing physician that you can talk about the psychology of medicine and the art of medicine as well.
Exactly. You see, psychology plays a huge part in medicine, and it's unavoidable. The patient is always going to have certain feelings, and the doctor has to figure out how to deal with those. So the art of medicine, to me, is not just the interrelationship between the doctor and the patient, and how they communicate and how trust and reassurance are established. But it's also the art of how the doctor can get information from the patient, and then how the doctor can sift through patterns. We're going to be calling medicine a pattern language. And so the patterns are things that doctors learn how to recognize.
And I think an important part of this is to help our students understand how they can be better patients and better communicate to their doctors so they can help their doctors do their job more effectively as well.
Yes, exactly. See, the patients don't usually understand the kinds of things that doctors need to know. And it all has to do with patterns. So doctors have to ask a lot of questions that have to do with things that only the patient knows. And so the patient has to be able to really think about, like, how long has something been going on? Think about what kind of pain am I really having? Thoughts that they may not have otherwise.
I think another important thing that we should talk about is the placebo effect. It plays a profound role in medicine and our development of new treatments and drugs. We have to take that into account and understand whether or not these new treatments are actually effective or not, or better than just the ability of the physician to inspire hope and faith in the patient.
Placebo has probably been the actual history of medicine. It's what started out. And it's an interesting phenomenon that happens about 30 or 40% of the time. But the key to it is that the patient has to get a better feeling of hope and faith from this placebo in order to feel better. But the placebo effect can have amazing results in how people feel. It may not change disease.
And we can even talk to the students about the emerging science of the placebo effect and the idea that it has a real biological basis that we may be able to understand someday.
Exactly. See, this is also going to be a class in chemistry. And all of the things that happen in our body are really molecular interactions. And so we're going to be talking about the chemical effects of the placebo.
We can also then start off with the story of how the pharmaceutical industry was first developed in Germany to its current form today, with all the amazing drugs and treatments that are becoming available to us.
That's going to be a big chapter, the pharmaceutical age in Germany in the 1800s, carrying through the 1900s, where major breakthroughs came through in the realm of chemical treatments.
And then, of course, in addition to chemical treatments, we should talk about the history of surgery and modern incarnations for surgical interventions and what we hope that surgeons will be able to do in the future as well.
Yes, exactly. What's very fascinating in the history of medicine is all of the different kinds of surgical procedures that have already been done,
Yeah.
even before Christ.
Right.
It's quite amazing that doctors were doing these things.
Yeah.
They carried some risk for sure,
Yeah.
but surgery was one of the first actual effective treatments
Yeah.
that doctors had because it was very physical and objective. Chemical treatments were, mostly herbs and other natural therapies that were probably just symptomatic. There were very few that actually had effects on real disease.
Right.
So we'll try to emphasize on that and actually look at how many real chemicals affected disease at the time of 1900.
Yeah. And then, as part of the history of surgery, we should also talk about the more modern inventions of anesthesia and antiseptic technique, which allowed surgeries to become widespread and effective and relatively safe compared to several hundred years ago.
Right.
Yeah.
I think this class is really going to be a lot about evolution, the evolution of thinking,
Yeah.
and also some procedures that have been developed that sometimes are serendipitous. They happen sometimes by accident. But this evolution is continuing, and it's going to continue in the future.
Yeah. So we'll end then by talking about the future of medicine and speculate about what medicine may have to offer us in coming decades and years, looking forward, what promising treatments are out there now, and what the big problems are for the future as well.
Yeah, it's very fascinating to think about what's just around the corner.
Yeah.
See, we've really nailed down the human genome, but that's only the beginning. Now we're going to figure out exactly what every gene does and how people are individual and how that might change their therapy if we know exactly what their genetic makeup is all about.
Right. So I'm excited about this class. The history of medicine is full of amazing stories of real examples of heroism along the way, and it gets to the very core of human existence. It's something that all of us will encounter the medical system at one time or another. All of us will become ill at one time or another. So it's really a universal experience.
Well, this is what I think we're going to be striving for, is a course that's basic enough that almost anybody can understand.
Absolutely.
And that it will have important aspects to it that can benefit people in the future, not only to achieve better health, but to just understand what's behind disease.
Yeah.
My name is Greg Gates, and I have practiced medicine for over 25 years in the Monterey Bay area, both in emergency rooms and urgent care clinics. And after about 15 years of practice, I realized that patients really have no good way to understand medicine. You can take all sorts of classes in biology and physiology and anatomy, but you don't really understand disease or the treatment of disease. So I wanted to create a class that at first I thought might be in cartoon form. And during this class, you will see some of these cartoons that are 25 years old. So I was intending to reach the general student body, not just people who want to go to medical school or practice within the field. Because these people can benefit the most from just getting this kind of education that they don't have any other good way to acquire. So the idea took some doing to create, and I have to hand it to Grant, who really helped get this class together, because he's the principal biologist from the faculty to help create this class with me. And he's also had quite a bit of training in medicine himself. So Grant and I are going to try to create a very basic course in medicine that's understandable by just about any student from high school. You won't have to understand anything so esoteric. And we're going to teach people the art of medicine and how to understand what the doctor is doing and how to communicate with the doctor. And also the whole history of medicine, because a lot of it is stuff that was thought and used and maybe felt to be effective, but has been discarded because it turned out to be just placebo. So we're going to go into the psychology of medicine and the chemistry of medicine. And this will all create a big overview that hopefully people can walk away and feel like they've really got something to use. My name is Greg Gates, and I'm a medical doctor with the practice of medicine in the Monterey Bay Area for over 25 years, both in emergency rooms and urgent care clinics.
Perfect. Okay. Now the where you got your medical training. And
I got most of my medical training in Atlanta, Georgia at Emory University, which was a great mecca for medicine in the entire South. And then I received other training in the Air Force as a flight surgeon, studying aerospace medicine. So my practice has been mainly general medicine, which covers almost everything you can think of, whatever walks in the door. So the way we've designed this course is to be completely basic for all of the UC students, so that no one has to have any particular pre-achieved knowledge to get something out of this class. We're not only trying to reach people who would go into the medical profession, and I think this is a great benefit for those people. I wish I had had a similar kind of class before I went to medical school. But the people we really want to reach are the ones who are going to be the patients, the people who have to take care of themselves and have to communicate and converse with a doctor in a meaningful way to get the best out of that particular relationship. So when I first started thinking about what would a patient need to know to understand medicine, a couple ideas came to me right off the bat. And the first is just the history of medicine, to understand how all of this evolved with the myriads of ideas and different treatments and practices, a lot of which just turned out to be no better than placebo. And that's the other part that I think is crucial to understand medicine, is the idea of placebo, because this permeates the whole history and the real roots and beginnings of medicine.
I'm Grant Hartzog. I'm a professor here at UC Santa Cruz in the Department of Molecular, Cell, and Developmental Biology. I was an undergrad at UC Berkeley, and then I spent several years at UC San Francisco, first as a medical student, and then I went on to graduate school where I earned a PhD in biochemistry and biophysics. Subsequently, I trained in the Department of Genetics at Harvard Medical School. Although I'm not a practicing physician, I've been around the world of medicine for many, many years. And a big part of my job here at UC Santa Cruz is to work with students who are headed on to careers in healthcare. One thing that I'm really excited about in the class that Greg and I will be teaching together is that we talk about aspects of medicine that students don't normally hear about in their other undergraduate studies, or even in professional school studies, where you just don't have enough time to hear about the history of medicine, about how our current state of knowledge in medicine came to be. We also spend quite a bit of time talking to students about the psychology of medicine and about the nature of the patient-provider interaction and the importance of that dating back to the very beginnings of medicine 20,000 or more years ago.
sorry, Grant, I think we're going to have to redo this.
Yeah.
Sorry about that.
I'm Grant Hartzog. I'm a professor in the Department of Molecular, Cell, and Developmental Biology at UC Santa Cruz. I was an undergraduate at UC Berkeley and then went on to the University of California, San Francisco, where I was a medical student for several years before I decided to get a PhD rather than an MD. I subsequently trained in genetics at Harvard Medical School before coming to Santa Cruz about 20 years ago. So although I'm not a practicing physician, I've been around the world of medicine for many years. I'm particularly excited about this class because we talk about aspects of medicine that most students are unlikely to learn anywhere else, whether they're going on to a professional school or to a non-medical career. We've specifically designed this course to be accessible to all students. You don't need to be a science major to profit from this course and be successful in this course. We'll particularly emphasize how medical providers gather information from their patients, how they come to decisions, and how you as a patient can help your provider do a better job in their task of problem solving, understanding the nature of your complaint and your disease, and helping devise an appropriate therapy to treat you. We'll talk about the history of the pharmaceutical industry, about the history of modern medical science beginning in the Renaissance, coming up to today. And we'll also talk about what we view as the future of medicine, promising new areas of research, difficult problems that still need to be solved, and potential solutions to those problems. So at the end of this course, we hope that you'll come away with a broad knowledge of the history of medicine and the history of science, and more importantly, with a good understanding of how doctors make decisions, what information they need, and how you as a patient can be a better partner with your physician to restore your health. Although much of our class will focus on the history of Western medicine, that's only one of many disciplines of medicine that have arisen over the course of human history. So a big part of the class will be also to talk about Greek medicine, Indian medicine, Chinese medical traditions, and others as well. We'll also talk about the development of alternative medical therapies in more recent times. although much of our class will focus on the history of Western medicine, that's only one of many disciplines of medicine that have arisen over the course of human history. So a big part of the class will be also to talk about Greek medicine, Indian medicine, Chinese medical traditions, and others as well. We'll also talk about the development of alternative medical therapies in more recent times. Perfect.